people registered for our session today, which is really exciting to see. I'm Brunilda Ferri with the Connecticut Community Nonprofit Alliance. The Alliance is the statewide association for community nonprofits. Our mission is twofold: to advance public policy for community nonprofits and to support capacity building through our various programs and services that we offer our members. We are here today to talk about some key findings and implications of a nonprofit survey that was administered in collaboration with our partners, who I'd just like to take a minute to thank. They are here on the call with us today: Lauren Patterson with the new Canaan Community Foundation, Jackie Downing from the Community Foundation for Greater New Haven, and Ann Urasic and Jim Burson with Fio Partners. So thank you all for your support on this project. The survey we completed included participation by more than 250 nonprofits across the state and provided really valuable insights into the challenges that nonprofits are experiencing. And it really highlights the pandemic's impact on nonprofits of all sizes across our state. So in today's session, we're going to review some of the survey's key findings and implications, and then we'll move on into smaller group discussions like Ann mentioned. So I'd like to hand it over to Jim and Ann, who's going to review the data.
Great, and hello everybody. There is a lot of information here, so I think you'll hear Ann and I a little less as we go through the slides. It'll be hard to sort of take everything in that you're seeing as well as what we're saying. So we'll try to be spare in our comments, really sort of hit the highlights. I also want to thank not only our partners with the community foundations, but also all of the community agencies that in these very busy times spent 20 minutes or so participating in this survey. We ran this survey in a very tight time frame in order to have this data fresh. So essentially this survey was run the last week of June and the first week of July. So you're looking at information that is about a month old. I also just want to quickly thank Melissa Harris on the Fio team, who put together this incredible presentation. She made sense out of a tremendous amount of data, not just in terms of the visuals, but really sort of the story and the analysis that's here. So she's not able to join us today, but we would not be here without her great efforts. So as you look at this first slide, as Brunilda said, we had 258 respondents. And one of the things that we really sort of jumped out at us was, and you'll see this throughout the story that we tell, is the different impacts for smaller organizations and larger organizations. And so really what we saw amongst the smaller organizations were really in the fields of arts and culture, education, and basic needs. Larger organizations were much more concentrated in children's services, adult behavioral health, and developmental and intellectual disabilities. You're going to see as we go through the presentation that we see differences by type of organization. We see differences by size of organization. We didn't really see any differences by geography. We're still looking to dig, but nothing really popped in terms of geographic differences. Ann?
Sure. So really the first thing we were interested in understanding is really the impact of the environment and the COVID crisis on service delivery and impact on services. I think for me, as I've looked at the data, this is one of the more striking findings in the survey response, which is that over basically 65% of respondents reported delivering services in a moderately or severely reduced capacity, with 5% of total responses actually suspending services altogether. On the flip side of that, we saw 23% of respondents actually increasing their delivery, while 7% really held steady. I think this is where our interest in the size of organization really comes through in the data. When you're looking at this more closely, organizations with budgets under $1 million were more than twice as likely to experience a severe or total reduction in service delivery. And if we dig in on sector a little bit, what we really found is that it was arts organizations in many ways that were more likely to be severely offering services in a severely reduced capacity or not at all. As leaders responded to this in terms of how their programs and services have changed, they really talked about the shift to online, moving both programs and services to an online format. We also saw this really impacting and showing up in the use of telehealth, and we'll talk a little bit more about that as we go through the results today. In addition to that, the other sector that we saw as severely impacted was educational services, particularly services that were offered in a school environment. Jim?
So as we're watching what's happening down in Washington, we know that it certainly appears that benefits for unemployed, et cetera, will end at the end of this month. And we asked our survey respondents what they thought would happen as a result of that. And you see that 44% see an increase in terms of individual need following the end of those benefits. Interestingly, healthcare organizations, non-hospital organizations, 62% of them felt that there'd be an increase in need. Which is sort of interesting given that this is a healthcare pandemic. Certainly telehealth is critical, and from a public policy perspective, in terms of state government and funding, et cetera, the need to continue telehealth, particularly for large organizations and healthcare organizations in the state, is seen as critical as a continued need going forward. Among small agencies, we really saw about 10% indicated that they may need to pivot their services in part or in whole. And 15% indicated a continued need or reliance on technology to support program operations. Yeah.
Thanks, Jim. One of the things that we were interested in understanding was the critical needs that in many ways respondents saw that needed to be, in so many ways, those that the organization served, that sort of needed to be addressed. And the 4 top ones were basic needs with a particular focus on food security, mental health supports, employment supports, and housing. And I think, again, when we look at this issue from the standpoint of large and small organizations, there was really strong alignment around these 4 critical needs. In addition to that, there was alignment and concern about childcare, access to internet, as well as the kind of challenge of homeschooling and education. In addition to that, we asked respondents around overlooked or underserved populations. And there was a little bit of a difference here depending on the size of the organization that really aligned with the type or sector the organization found itself in, which really may not be a surprise. For smaller nonprofits, the focus really was on youth, elderly, and low-income families, as well as undocumented residents and households without internet. Again, this may be the presence of both youth development organizations, arts organizations, kind of in that smaller organization subset. From a large nonprofit perspective, again, interest and concern about undocumented residents, individuals with disabilities, and there we also see concern about low-income households, the homeless, and the elderly. I think if you look across all of the information in terms of overlooked and underserved populations, it's a lot about service delivery. How are we still engaging our clients in the services that they were receiving prior to the COVID crisis? Jim?
And this slide, it sort of amplifies the particular concern around small organizations who frequently are on the ground most connected to residents in need. And you see that there's a great disparity between who's struggling amongst the size of organization. And it is very concerning for all of us. I think I want to sort of take a moment now just to sort of let you know who's here today, right? So I can't actually tell you who's here, but I can tell you who registered. About 25% of you are foundations in one way, shape, or form. Community foundations, government, bank foundations, et cetera. About 10% are consultants that are capacity builders looking to support organizations, and the rest are community agencies themselves. But this really sort of tells a great story, or an important story, that we need to figure out how to really protect and save our most vulnerable small organizations, who again are the closest, oftentimes the closest organizations working with residents, particularly disenfranchised residents, disconnected residents who are at greatest risk during this pandemic and all that is happening alongside of it. Anne?
Great. And so the other sort of, when we kind of extend this idea of wellness and the pulse check, part of this is looking at both the financial implications as well as in some ways keeping staff safe as we look ahead around the COVID crisis. It's really important as you look at the data. Jim talked a little bit about that. We should have thrown a milk expiration image somewhere in this deck. This is only a month old, and really from our vantage point, the context for large and small nonprofits is already changing in the state. This does not take into account in many ways some of the proposed changes where the state is really asking larger agencies to return funding for those that did receive PPP funding. And this is an issue that the Alliance is addressing, but it's important to know that that wasn't kind of known when leaders were completing this survey. So at the time of the survey completion, larger organizations really were more optimistic than smaller agencies, that they'd be able to fund payroll, that they'd be able to provide services over the next 3 months, and also more confident in many ways around their ability to offer PPP. PPE protection, PPE equipment to staff, as well as in terms of sufficient testing for staff and clients. A concern here is that, overall, about 1 in 5 nonprofits, or just about 21%, believe that they were somewhat or very unlikely to be able to fully fund payroll for the next 3 months. And 1 in 4 was worried about, in many ways, being able to provide their services over the next 3 months. And again, what we need to see is the kind of recognition of the difference between how this crisis is impacting our larger entities versus our smaller entities. Jim?
There's a lot of data on this slide. I'm not going to try to read every box and chart here for you, but I really think what's most highlighted for me here is that 4 of the 5 top issues are revenue-based. And so whether it's the loss of earned revenue or impact of philanthropy, particularly in terms of fundraising events or being able to capture donations from individual donors, organizations are really struggling to deliver the revenue they need to support operations. It's one of the reasons why about 10% nationally of the nonprofit workforce has been laid off over the first several months of the pandemic, and really places all of our organizations at risk going forward. So as organizations try to sort of balance their budgets and make their way through this time, the revenue is gone, and we're not going to be able to, organizations are not going to be able to sort of cut to sort of balance their budgets. A real injection of resources is really going to be needed to help organizations continue and persist during these times. Anne?
Great. And so when we look at the kind of overall financial impact, one of the things that we were interested in understanding is the financial losses and the projected financial losses as a percentage of operating budget. So when we take a look at that, it's important to recognize that only 18% of organizations experienced no financial losses due to the COVID crisis. 47% of healthcare organizations did report losses of more than 15%, despite the fact that this is a healthcare pandemic. As we've talked with clients about these issues, for those that had diversified service portfolios, some subsegments of their work were in high demand and able to operate in this environment, and others really went to a complete and total standstill. And you see that impact in these results. In addition to that, almost half of the larger agencies were at the point of the survey. And again, it's important that this is moment in time data. We're saying that they were able to keep their losses under 5%. And so again, sort of the impact is different depending on the size, but only a quarter of small agencies were able to do the same. In addition to that, smaller agencies were more than 4 times as likely to experience losses in excess of 30% of their operating budget. And again, in our kind of analysis, arts and culture organizations represent about 1/3, followed by education as well, kind of in that smaller organization mix. But again, this has been devastating, I think, to our organizations under $1 million. Jim?
I wish there was more good news, but I mean, what we're really seeing here for this slide is that leaders are really overwhelmed with decisions. The reopening concerns are significant regardless of size, as are the financial concerns. And really what we're seeing is our leaders are trying to figure out what information they have, what information they need in order to make critical decisions, particularly around reopening. How do I keep my employees safe? How do I keep those that I serve safe, right? And it's shifting from being concerned when people are calling out sick to saying, no, please call out sick. We don't want you in. How do I actually keep the place safe for everybody? Again, real decision overload for all of our sector that we're seeing here. And last, and the third item that we want to raise, and again, this is sort of when the survey happened about 2 weeks after the George Floyd incident, we're seeing increase, and you'll see in the next couple of slides as well, increased organizational attention to issues related to race and racism. Anne?
Thanks, Jim. And so again, we were really interested in understanding leadership's perspectives around the challenges that they're facing as they look ahead. And again, there's a little bit of a bifurcation here depending on the size of the agency. For smaller agencies, what we see in this data is the fight for survival, whether it's financial, whether it's how will we deliver services, and even this last piece really around engagement. How do I keep my board, my volunteers, and my community and stakeholders engaged in our work during this time? For larger agencies, this is a lot about how do we continue operations. So there's a strong focus on staffing levels, supporting staff with burnout and morale. We can all kind of, I think, acknowledge being zoomed out, but really, how do we work from home? How do we maintain our team from home? A real focus on really how do we have business continuity during this time, as well as finances, certainly, whether it's revenue loss or canceled fundraisers, trickle-down effect of state decision-making related to financials, and funding support for the resurgence of the virus that could come in the fall. And the last piece for large agencies is also really about safety. Again, Jim talked a little bit about the risk management calculus that each leader has to make in terms of keeping staff and clients safe during this time. Managing the physical plant and ensuring that there's equipment available to staff to keep them safe, and the need to self-fund some of those purchases. But again, these leadership challenges are overwhelming. I think what was amazing in the survey was just to see the rich range of responses. There is a lot on leadership minds right now, and we'll talk more about that as we get to implications of the findings.
So I'll start with the box on the right, which I think was one of the more startling pieces of information that we saw through this process, which is that 1 in 5 organizations are considering an executive search over the next 3 to 6 months. We're really not sure what to make of it, quite frankly, but it is very telling that in the sector, in addition to all that is happening that is uncertain, that leadership of organizations may be uncertain as well. And so we are very concerned about the risk for these organizations and how they navigate through these challenging times. And the continuity of leadership is certainly really important as well. On the left, as you look at these activities, I just really want to sort of take a moment to point out number 4 and number 6 on the list. And just to sort of explain that, we recognize that nonprofit leaders are really in the process now of learning more about the issues around race, equity, diversity, inclusion, social and racial justice, becoming an anti-racist organization. The language is we're still many of us are still learning and becoming comfortable with and understand in terms of understanding what it means and what it implies. And so we really want to sort of use broad language to sort of capture where folks might be on their journey as an organization, as an organizational leader. But what this really says to us is that this is a critical priority for nonprofit leaders moving forward, and which is why you've heard many folks talk about the twin pandemic of racism and of the coronavirus. And so organizations are now trying to grapple with both of these issues simultaneously in a way that is responsive to community, responsive to clients, responsive to staff. Anne?
And so one of the things that's important to recognize is the difference between the previous slide and this slide is really the difference between being interested in undertaking an activity. So we talked, there's some other sort of interest in strategic planning, interested in professional development. But we also asked respondents, what do you need help with? What do you really need external funding to support you to address? And again, it may not be surprising, but it's in the top 3 is this work around racial equity and DEI. I think organizations recognize that they need to make investments, whether that's professional development, support to staff, or really just an analysis of kind of policies and procedures with a lens towards equity. This is the work that organizations are interested in doing. The call here in the survey results is who will fund that work. And again, thinking about what are the funding streams available to support that kind of support for organizations and organizational leaders. The other activities that certainly bubble up here are professional development, executive coaching, business planning with an interest particularly towards earned revenue opportunities, strategic planning, and board training. Jim?
Great. And again here, we have really sort of what are the other kinds of supports that organizations need or individuals need, right? So large and small organizations alike want to deepen their learning around DEI and racial justice. I mean, I think that's very clear, loud and clear as articulated from the survey. There's also a critical need to re-engage clients and donor bases along the way. And as well as, so jumping through my notes here. And this issue of marketing, design, and website development, right? We recognize that we have to find new ways to get our message out because we aren't seeing people anymore in person, right? We're not having random collisions at the Starbucks or the coffee shop or at the common restaurant where folks seem to run into each other. We really need to find other ways of connecting and communicating. And so these are some of the areas where organizations are seeing additional supports needed going forward. Yeah.
And Jim, before we go to the next slide, I'd just also like to add, I think in some ways there was also a little bit of a difference on some of these questions from a large and small vantage point. Small agencies also still had interest in grant writing, pivoting their strategic plans, and board governance. A little bit different than larger organizations, to Jim's point, that really wanted to dig in around cultural sensitivity, DEI, unconscious bias, as well as change management and encouraging innovation. And so again, you see a little bit of a difference here between the small and large organization responses.
And again, this question of language in terms of what do we really mean by cultural sensitivity, implicit bias, racial justice, racial equity. I think many are still sorting through what this all means for them in terms of, again, where they are in their journey and what these terms mean. So we try to be as broad and as inclusive as possible to really sort of capture where folks were. A couple of closing thoughts before we talk about the implications. You know, we really saw a couple things here. One is that for small and large organizations, about half the comments were directed towards the Alliance and its activities. I think there's a real sense that advocacy is critical moving forward to really sort of support the sector in the future. Both groups, concerns about finances and funding, were most frequently mentioned, along with expressing worry about 2021 finances, right? So there's this whole question of what's next. You know, we've made it through now, and what's happening around the corner, and this real anxiety and concern about the future. Folks feel like they've sort of made it over the first hump potentially, and now they have to contend with the uncertainty of state budgets, federal funding, CARES Act money, reimbursement sources, being able to raise money. All of those things are really sort of pressing on organizations. And again, and the other again is reopening, right? The cost, the complexity, the risk associated with reopening is really a great concern for organizations of all sizes. And how do organizations pivot throughout, and the need for really increased flexibility from funders to be able to make their way through these times. So I want to ask Brunilde to sort of share some of the thoughts and perspectives of what this data means from a state alliance perspective.
Hi, everyone. Thank you, Jim. So as an organization whose mission is to ensure that nonprofits are being supported, it was a little hard to hear how so many of our members and nonprofits across the state are struggling. But it was also validating in that a lot of the data is in line with what we have been advocating for in Hartford and in Washington, D.C. So this feedback has been really helpful in that it's informed our public policy and our advocacy work moving forward. The survey findings from our perspective have really underscored how government funding, including PPP and other sources, has been really critical in keeping nonprofits afloat throughout the pandemic. But as the funding dries up, it'll be more important than ever for the Alliance and nonprofits to continue to advocate for resources. Most recently, we pushed back against the state policies that prevent providers from accessing coronavirus relief funds if they have received PPP loans, and we are actively advocating to reverse those policies. I'm really happy to report that just now, as we were on this webinar, we've made some traction in our advocacy in that just a few minutes ago, Senate Republicans have released a letter urging the governor to reverse this policy. So we are making headway on that front. We're also working towards permanent rate increases for providers, which we hope will bring stability, in the delivery of services. So funding and support is critical for nonprofits as they expect to see an increase in demand for services once government benefits taper off, as the survey showed. For example, we're seeing that basic needs organizations are already struggling and they're starting to see an increase for services tied to the expiration of unemployment benefits. Once the benefits dried up and the prohibition on evictions end, we're anticipating a housing and homelessness crisis potentially. Also, as another example of people in need of mental health and substance abuse services, it was also a top population need that was identified through the survey, and we expect demand to go up as people start to get more comfortable resuming services, whether they're in person as providers reopen or through telehealth as it's becoming more accessible. And this includes people, not folks who were previously receiving services and stopped due to the pandemic, but people that need services because of the pandemic. So that includes first responders, healthcare workers, people infected with COVID, or people who have lost loved ones to COVID that will need services moving forward. The survey also highlights for us the need for telehealth, as 40% of nonprofits with a budget over 1 million identified the need for the use or technology, particularly telehealth, to support their operations. There's good news on this front. The Alliance has been advocating to the legislature for a while now for a telehealth bill that will allow for flexibility and reimbursement to be extended into the future. We're also pleased to announce that House Bill 6001 passed the legislature this week during special session that just adjourned yesterday, actually. The bill is now headed to the governor's desk, and it's expected to be signed. So we're really happy that we've made headway on that issue as well, as it was identified as a top need in the survey. So the bill that I'm referencing, it continues to pay for telehealth services at the same rate as in-person visits and allows services to be delivered from any setting. It allows for audio-only session and the use of any HIPAA-compliant platform, which we've heard from our members was a really big issue. I want to turn it over to my colleague, Zoe Schwartz, for just a minute, who can talk a little bit about capacity building needs that were identified in the survey.
Thanks, Brunilda. So in addition to advancing public policy to support nonprofits, we also strive to build nonprofit organizational capacity. One takeaway from the survey that stood out to us is the increase in demand for basic needs services and an emphasis on food security, food insecurity. So in response, we've launched a new program. Connecticut is a new and creative approach to responding to the effects of COVID-19 in Connecticut's nonprofits and communities. The program selects nonprofit service sites which have been adversely impacted by COVID-19 and provides critical services in the areas of food security, anti-poverty services, and/or housing. So this program connects nonprofits with service members who assist in growing their volunteer base and strengthening their ability to respond both during and after this public health crisis. We're placing service members at nonprofit sites at no cost to the nonprofit. The survey findings also highlight how professional development is more than just one-off trainings. It includes, pursuing academic degrees, formal coursework, continuing education credits, attending conferences, and even more informal learning opportunities like roundtables and forums. So moving forward, we will focus our work to develop a professional development and training program that helps nonprofits staff enhance job-related knowledge and skills, increase their productivity, be better leaders and managers, and prepare them for higher level roles within your organization. Right now, while many are still working from home or only working in the office part-time, the opportunity to increase the professional development among your staff has never been easier because people can just log in from wherever they are and they have access to high quality learning opportunities, whether they're live or on demand. So understanding that nonprofits also need to find ways to support their staff with limited resources, we have expanded our academic partnership program to offer our members, and in some cases their dependents and spouses, tuition discounts to a range of colleges in Connecticut and outside of Connecticut. Many of these academic partners are transitioning to online learning, which is one step in removing at least one barrier to starting or finishing a degree. The survey also highlights how back office services are also in need, and the Alliance Allies program provides those that help. Our member marketplace allows you to search for back office services from printing and office supplies to CPAs, lawyers, IT needs. And a lot of the Alliance Allies specialize in working with nonprofits, and many of them provide services to organizations that are part of this webinar today.
Thanks so much, Zoe and Brunilda, for those comments. I think we just wanted to also touch on sort of broad implications that we at Fio also observed in the survey results. I think the first is the variation of impact. From the beginning of this crisis, I have really leaned into this idea. This is not a one-size-fits-all impact. So whether you're large, you're small, based on your geography, your size, your sector, there isn't an answer here. There isn't one solution, but there really does need to be a range of approaches that we're thinking about to support the nonprofit sector here in the state going forward. One of the things we are very concerned about is just leadership stress. CEOs are managing so much. Jim talked about that risk calculus that each leader has really had to be thinking about. I think when we started this crisis, we talked about it a little bit as a sprint. It is very clear that this is going to be a marathon. And so how do we support our CEOs in really having the resilience, personal resilience, to kind of continue to kind of operate in this really challenging environment? You know, our call to funders is really around intentional capacity building. We are concerned about closures. We are concerned about the loss of critical community-based organizations that have high trust relationships in their communities and are the go-to service provider. We've got to be looking at our ecosystems of nonprofits and really thinking about what does sort of wraparound support either look like, what does scaffolding look like, how can we really be intentional about supporting organizations in their work during this time. We are equally concerned about staff and staff morale, making sure that staff have the supports to deal with the implications of the pandemic, but also in so many ways, the work that we need to do around organizations to address racial equity, both internally and in partnership with community. And lastly, we really want to think about how can we inspire and resource invention and innovation. We have been incredibly impressed and just amazed at the speed at which so many of you as leaders have transformed your business models. You've enacted changes that I'm sure even your staff never thought were possible. And so we want to, how do we continue to encourage that? How do we sort of see this challenging crisis as an opportunity to both reinvent business models, to draw new people to your work, and whether those people are here in Connecticut or around the globe, that working virtually and enacting services and programs virtually really does open up a whole new way of thinking about your work and the change that you hope to make. And the last comment that we'll make, and you saw this in the results in terms of the perspectives of small organizations and board engagement, and I think it's true for everyone right now. Your volunteers, your board members are people just like you, which means that they're also dealing with all of the implications of all of this. And so how do we actually lean into board development right now, support boards in really using this technology to still come together as a cohesive group and stay engaged in the work of the organization? Again, we just wanted to hit some of our high points and observations, but in so many ways, as we're looking at the data, it's not so much about what we think about it, it's really about your perspectives. So we're gonna have two ways to hear from you today. The first is we have a SurveyMonkey survey that's very brief, it's only 3 questions, for you to jump in and share your perspectives from an individual perspective. I am going to lean into our colleague Ben and Jim to begin to also set up the breakout room so that you can talk to each other about sort of the breakout. So Jim, do you want to tee that up?
Sure. So if you have your phones handy, you may want to take a picture of the screen because it has the 2 questions that we would love for you to discuss. Also, when you go into the breakout room, if you want to change your, however you've named yourself, to your first name in the organization, because we don't have a lot of time for introductions, etc., we really want to encourage you to get right into the discussion. We're going to have, and we're going to see how this works as you all get randomly assigned, including us. Hopefully, through the magic of randomization, someone from the Alliance or one of our partners or someone from Fio Partners themselves will be in your breakout group. Just sort of validate that quickly. If so, we will take notes of the conversation to capture it. If not, we're going to ask that one of you kind souls volunteers to sort of capture notes, whether you track it in the chat or somewhere else. That would be great, because we really want to make sure this is an ongoing dialogue. The community foundations in particular are really curious about these questions, as are we, and I think all of you, and we make a commitment to share this information back to all of you. So Ben is going to work his magic, and all right, and you may be invited to join a breakout room, and you will be, if you hit yes or accept, you'll be magically beamed over, and then you'll be magically beamed back.
And so we're going to give you just about 14 to 15 minutes in the breakout, and then we're going to come back and hear from a couple of the groups before we close out at 1:30. Ben, you're on.
I'm on. So everyone, as Jim just said, momentarily, you should be getting an invitation on Zoom to move into a breakout. If you happen to be calling on a phone right now, there's only 3 or 4 of you. You may have a limited functionality in the breakout rooms. We've seen some folks are dropping off the call now, and that's totally fine. We welcome your feedback in SurveyMonkey. We're hoping there'll be 10 to 12 people in each of these breakout rooms. Please unmute yourself when you get there. And If you have any issues, you can chat all of us and send me a chat, and I can pop into your breakout room and try to figure it out. So without further ado, I'm going to click the button, and we'll see if this works. Here goes.
Have fun. Jim, you want to bring us back to the slides, and then we're going to hear from a couple of our groups. So I'm going to open it up to hear highlights, and we're going to start off with Brunilda. Could you share a few highlights from your discussion?
Sure, I'm happy to. So we had a really great discussion in our group. We talked about a few different things that I want to highlight. The first is we talked about how in terms of the messaging of the data and the conveying of the data, how even, what we didn't want to get lost is that even large nonprofits are struggling despite sort of like what we're seeing at face value here. It's sort of all relative. Even the larger ones, their expenses have been going up as funding has been drying out. And so it's a really nuanced situation that we're talking about. And so we just didn't want that to get lost and wanted to make sure to convey that to the funders and others, that nonprofits are sort of struggling across the board here. The other thing we talked about was sort of planning for the future. We know that this is a sort of point in time survey. So how are nonprofits thinking and planning, and also funders for the long term, and where is funding going and how it's being redirected? It's understandable that priorities will shift to react to current situations, but on the flip side, nonprofits are saying that they need some stability in funding and stability in expectations of funders so that they can plan. And another thing that we talked about is how we were all sort of very blindsided and shocked by the slide about how 25% of leaders in CEO executive positions are thinking about transitioning sometime in the near future. And so we're wondering sort of like what's at the bottom of that and why that's such a big percentage of folks that will be experiencing a CEO transition in the future. And then we also talked briefly a little bit about maybe potentially doing a follow-up survey and how that would be helpful to some folks in the future, not only just to see what's changed, but also to see sort of what things haven't changed and what are the constants between this survey and the next survey, and what are the trends which we think would really get to the root problem, to some of the root problems and issues that we're sort of talking about. So that's the gist of our discussion.
Awesome. Thank you so much, Brunilda, for those highlights. I'm going to head over to Lauren.
Sure. Hi. So our group did feel like, in terms of reactions, that what they had been seeing was pretty consistent with what the survey described, which was great. We were also struck by the leadership transition statistic. We talked a bit about that and identified a couple of needs to support those things. So one was ways to support the staff remaining at those organizations in terms of culture, growth opportunities, professional development, but making sure that overall those organizations remain stable and those staff turnover across the organization is not affected by that leadership transition at this point in time. In parallel, we also talked about the need for executive supports. If those leaders are coming into this pandemic, there's a lot of turnover in that position to begin with in the first year or so, and so needing potentially some particular supports for those new leaders that are incoming. And then on top of that, talking about the need to really equip, whether it's new or incoming executive leadership, to effectively lead their boards and manage what are professional and personal strains on board members right now, and how can they be the most effective at this really critical juncture. Other things that we wanted funders to know was really about how so many organizations are stretching beyond their typical mission to provide basic services, tech support, troubleshooting, mental health supports, other things. So really just kind of went further on that need for flexibility in their funding. And then we did have a good kind of interesting question at the end around DEI and wanting to dig in more. So particularly for organizations that are largely serving communities of color or are led in particular by executive staff of color, if there were needs for DEI work within those organizations, or if it had something else to do with translating the work of organizations into this space. So just wanted to understand more, particularly in that area.
Great, thank you so much. I'm going to go to see if there's one more group that would like to share. I'm going to actually head over to Jim Burson. Jim, do you want to share just a couple highlights from your group?
Sure. I'm going to see if I can I can't really pull them up from my notes, but I think we talked about a couple of things. I think the DEI piece really came out loud and clear as the thing that caught folks by a little bit by surprise, I guess. You know, I think there was an assumption going into the survey, or at least this webinar, that the focus would be COVID, COVID, COVID. And I think whether it's the timing of when we did the survey or the fact that organizations are really attuned to these issues, and folks in the room really spoke to their own challenges around what is the message I should be sending? You know, should I be too, is it possible to be too bold? Is it possible to be too timid? Will I end up offending? Will I end up not offend? You know, those questions of how do I respond to this complicated issue. And so not that we sorted through it and resolved it in a couple of minutes, but that really popped for folks. I think in terms of implications, you know, I think that there's a question of more disruptive thinking around philanthropy and how can those resources, you know, so within DEI, how much of this is about wealth inequity, and how do we really think about philanthropy as ways of redistributing wealth or preserving one's wealth. And so I think some really important questions were raised, and one of our colleagues in the room mentioned that not only from a fundraising perspective, but even from a staff perspective, when donations are coming in, younger staff are asking well, what's the angle? What's behind this? What do they really want? And so I think there's this growing set of questions around the role of philanthropy, and, you know, 5% giving out 5% means that you're holding on to 95%. And so, you know, donor advised funds are also around wealth protection. So it's this, I think we're seeing everything being turned on its head a bit. And that's not a bad thing.
It's not, and in so many ways, it really reinforces this opportunity to look at so many of the systems of the sector and really be reflective about how we can use this opportunity to think about something different for the future. With that, I'm going to turn it back to Brunilda to wrap us up and close us out. Thanks again to everyone.
Thanks, Anne. I just want to take a minute again to thank our partners, Lauren, Jackie, and Jim, Melissa, and everybody that participated in the survey and that participated in the Learn and Share session here today. It was really valuable and informative to the Alliance and our work, and I really look forward to seeing how we're all going to use this information to inform our work in supporting community nonprofits. So thank you.
Awesome. Thank you so much for participating, everyone. And again, just a quick reminder to complete the SurveyMonkey survey and let us know your thoughts. Stay in touch. Thanks, everyone.
Thank you for your support.